Gracious and most merciful God, in whom we live, move, and have our very being, we are grateful for this moment. And we ask for your anointing to rest upon us, that we may continue to allow our moral imagination to take root on the south side of Chicago. We thank you for the possibility of healing and reinvestment on the south side of Chicago. We are thankful for a chief advocate who allows us to do work that brings about flourishing in communities on the south side of Chicago. We are grateful for this gathering and the announcement that shall come forth, and we offer this prayer in the name of the Chief Medical Officer of Healing, by the name of Jesus. Amen.
Amen. Wow. Wow. The Chief Medical Officer of Healing. Me. Thank you, brother. So, Reverend Moss, I so appreciate that and appreciate that invocation and those warm words. And again, welcome to all of you all and what is absolutely a historic day in this great city. I'm Dia Nichols. I am the president of Advocate Healthcare, the largest health system in the state of Illinois. We are the second largest employer in the state. We serve patients across 11 hospitals and more than 250 sites of care. And, you know, I have been a health system executive here in Chicago for many, many years now, and I have been alarmed for a long time by the fact that citizens on the south side of Chicago, by and large, live 30 years less than their counterparts a few miles north on the north side of the city, simply because of where they live, simply because of their zip code, right? And I see some heads nodding. The healthcare disparity gaps in underserved communities across this country keeps me awake at night. In fact, it's one of the main reasons that I got into healthcare. The largest health disparity gap in this country is right here in the city of Chicago. One of my favorite sayings by Dr. Martin Luther King Jr. is, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. You all have heard that. Personal story. Many years ago in the segregated South, my grandmother almost died because she couldn't get the care that she needed not far from her home. But thanks to one compassionate doctor, one angel of a physician, my grandmother lived. But here's the question. How many other patients in underserved communities across the country are having the same experience but not having the same positive outcome as my grandmother, right? And my wife and my son are here today, and they know the details to that story. But what I would say to you is, what I want to make sure happens is that everyone, regardless of who you are, regardless of where you're from, regardless of what you earn, regardless of what your zip code is, that everyone receives equitable care. right? And so here we are today. And so while we've made progress, there's still so much work to do. We still have so many health disparities. There's still so much road to travel on the road of health equity, on that path to health equity, right? And so Advocate Healthcare wants to change that. We want to bring widespread wellness to this community so people can live longer, healthier lives with their friends, their families, and their loved ones, because after all, that's what health and wellness is all about, or at least that's what it should be all about, right? And so that's why today we are announcing that Advocate Healthcare will invest $1 billion to support health and wellness on the south side of Chicago. And this investment represents, get on your feet, this investment represents one of the largest healthcare investments in the nation in an underserved community, and it's happening right here in the south side of Chicago. And yes, that is something you can applaud for. And so with this investment, folks, with this investment, we're going to build a new model of care that is designed to prevent and better manage those common conditions that contribute to those shorter life expectancies that I talked about, especially in underserved communities. A new model that better meets people where they live, play, where they work, and where they worship, Reverend Moss. A new model that keeps people out of the hospital, that meets them upstream before they become patients in the hospital. A new model that keeps people doing things that they want to do with family, friends, and loved ones. And here's the thing, this isn't going to happen overnight. So it's not as if I expect that I'm standing here saying this and tomorrow morning we're going to wake up and the needle's moved and all of a sudden health equity is going to be in the south side of Chicago. But together with this community, with our health workers, with our healthcare professionals, with our community of physicians and nurses, we have a plan to bring health and wellness to the south side, and we are bullish about that. We are committed to that. And I want you to hear me say that. So today I stand here incredibly proud, incredibly grateful, and let me tell you why I'm incredibly proud and I'm incredibly grateful. Let me tell you why. First and foremost, to our elected officials, let me have all of our elected officials stand, and let's all collectively give them a round of applause, our elected officials. All of you have been so instrumental in helping us along this way and along this process, so thank you for that. I'm grateful for this community, for your partnership, for your support, your ideas, your suggestions. The feedback that you have given us has brought us this far. We wouldn't be here today without you, without this community. And finally, my final point, I want to underscore this. My final point is I'm so grateful for the Advocate Health teammates. I'm so grateful for all of you. The Advocate Health teammates that work in this community, that live right here in this community, live right here in the south side of Chicago, thank you. I'm so grateful for all of you. And namely, I want to call one of them out, Dr. Michelle Blakely, who is the president and CEO of Trinity Hospital, Trinity South Sub, and she grew up in the south side of Chicago. And we're going to hear from Dr. Michelle Blakely in just a moment, and she's going to walk us through what this $1 billion investment is going to do and what it means to the south side of Chicago, and how this $1 billion investment is going to move the needle on health and wellness here. She's going to do that right after we run a short video that's going to really tell our story of how we got here. But I'm going to end how I started, and that's with excitement, right? Excitement for this $1 billion investment, excitement for the future of healthcare in this community. Thank you all for being here today. Happy holidays to you all, and thank you for your support in Advocate Health.
To be healthy and happy, to live fully. But when zip codes determine how well and how long we live, and there is much disparity between them, that is a problem for us all. It's an issue we must face and overcome together, and the time is now. Together, we can make changes to improve the health and lives of people living on the south side of Chicago. And no one knows better what our community needs than the community itself. So we held public listening sessions and focus groups and listened to hundreds of voices, including Southside residents, elected officials, faith and community leaders, and healthcare workers on the front lines. In partnership, we generated ideas, set priorities, and reimagined together how care is delivered in our neighborhoods to improve the health and wellness for all. Together, we came up with a bold vision for a healthier South Side, and Advocate is supporting that vision in a big way by investing $1 billion to give people on the South Side the care and resources we need to stay healthy and live our best lives. Over the next 10 years, $1 billion will be spent to create a new care network, with over $500 million dedicated to greatly expanding outpatient care in the community, including more than 10 new sites of care embedded in neighborhoods in trusted locations, adding more appointments to make it easier for access to both primary care and specialists. More than $200 million will be invested to expand our ongoing work to manage chronic diseases and address social factors that affect health, such as access to healthy food, housing, transportation, and prescription medications. We'll also focus on maternal and infant care, expanding access to pre- and postnatal care, plus wraparound services to support the entire pregnancy journey. Nearly $300 million will build a state-of-the-art carbon-neutral replacement hospital with the latest technology to provide the safest and highest quality of care for years to come. And we are investing $25 million in workforce development to support our current teammates and hire 1,000 more to care for our community.
I'm so proud of the investment that Advocate is making on the southeast side of Chicago, recruiting more primary care physicians so that more people can have checkups on a regular basis to find issues that they may have, to keep them out of the hospital and to keep them well. So when it's right in their neighborhood, that is so much better. I think that the community as a whole should become more healthy, and so I expect the life expectancy on the south side of Chicago to improve in the future.
This unprecedented $1 billion investment is symbolic of Advocate's long-term commitment to the health and wellness of this community. With our collective vision and dedication, together we can close the health equity gap on the South Side, achieve widespread wellness, and build a healthier future for generations to come.
Isn't that exciting? So this brings me to the point where I can start sharing the specifics around that investment. And I am so giddy. And I have to tell you, Dia messed me up because I wasn't expecting him to do that. So thank you very much for all of the support. And I am a woman of a certain age, so I'm putting on some glasses so I can read. So let me just first say, I was born on the south side of Chicago. I went to the beach with my family at Rainbow Beach. I went to high school at Unity Catholic High School in 81st and Prairie. This is real stuff for me. And so I cannot be happier to talk about how excited I am to work for an organization like Advocate that is investing $1 billion with a B and this long-term commitment to the South Side of Chicago. So at Trinity, people who know Trinity, we've long served this community. We're old, we're 128 years old. We've invested millions of dollars over the years. Advocate has added a new intensive care unit to Trinity. We've had a cardiac cath suite that was recently put in place, new dialysis, renovating the emergency department, which is going on right now, as well as adding medical specialties to the hospital. But guess what? It's not enough. Health and wellness does not start in the hospital. We want to provide our community with the resources that they need to stay well and stay out of the hospital. So, through community listening sessions and focus groups held over the last 9 months, we've heard from hundreds of Southsiders, including community members, faith leaders, and elected officials, the physicians from the team at Advocate Trinity, Advocate teammates, on how we could better address the needs of our community. And the community said this to us: we want more comprehensive care that offers convenient access to appointments, education, prevention, and management of chronic conditions. To my neighbors in this community that I love, I want you to know, we heard you. We will roll out a new model of care with 4 main components. I'll talk in more detail about what you heard in the video. The first one, more than half of this significant investment, over $500 million, will greatly expand outpatient care embedded in the community. We are establishing 10 new Advocate neighborhood care locations. These sites will serve the whole family. They will be located in churches, community centers, and more. They will be in familiar spaces, easy to access, conveniently located, and staffed by healthcare professionals connecting virtually to the Advocate Care team. We are proud to share that the first neighborhood care location will open in early 2025 inside of the Southside YMCA, with 2 additional neighborhood care locations in this community by the end of the year. We are also expanding our Amani Village, which is where we are. We're expanding this outpatient clinic to add immediate care with more doctors, more services, more appointments, and shorter wait times. And we are so grateful to have like-minded partners, like our friend. Where are you, Dr. Moss? Like our friends at Trinity United Church of Christ, who are equally committed to promoting wellness. We plan to add 85,000 new appointments annually, making it easier for the community to access primary care, specialists, and diagnostics. Yes, you heard me right, 85,000 more appointments to ensure that Southside residents get the health care they deserve right here in our neighborhood. We also have a mobile unit that will provide primary care access at sites across the community so that we can take care precisely where it is needed. And we're doing this because 84% of Southside residents who end up in the hospital have 2 or more chronic conditions like hypertension, diabetes, mental health needs, congestive heart failure, and more. And if we manage these conditions better on the outside, we move closer to our vision of health equity. I don't want people in my beds. And this brings me to the second big investment component: programs and services to prevent and manage chronic diseases. Advocate is investing more than $200 million in programs and services to expand our ongoing work in managing chronic conditions, including new in-person and virtual management programs, and addressing social factors that affect health, such as access to healthy food, housing, transportation, and prescriptions. We are already working to address food insecurity through our food pharmacy program, Pharmacy with an F, which distributes fresh produce and healthy staples to patients with metabolic conditions such as heart disease and diabetes. By a doctor's order, get a prescription for food. An advocate is breaking down barriers and expanding access to prescriptions for patients who might otherwise go without medications that they need. We have a free prescription program for eligible patients and medication home delivery for patients with limited access to retail pharmacy. Maternal and fetal health disparities are another key focus for us. The sad reality is, according to data from the March of Dimes, Black infants are 2.5 times more likely to die in their first year of life compared to other ethnicities in Illinois. We can change these outcomes by ensuring that moms and babies get the appropriate pre- and postnatal care in a clinic or outpatient setting. And we know that early access to comprehensive prenatal and postpartum care contributes to better outcomes for both mothers and babies and will lower the pregnancy-related deaths in our community. To address the specific challenges this community faces, we want to literally wrap our arms around our moms, ensuring that they have everything for a healthy pregnancy, delivery, and postpartum support. And as part of our community investment, we are expanding access to pre- and postnatal care by adding 5,000 annual OB/GYN visits, plus a robust set of new programs and wraparound services to address the entire pregnancy journey, including patient navigation, education, medication, connection to doulas, and social workers. We are excited to better serve our moms at every step of their pregnancy and in those important postpartum days. Right? I see some heads nodding. Because we know we can make a big difference in this space by adding these kinds of services. Our patients, community, teammates, and physicians also deserve a state-of-the-art facility with the latest technology that will provide the safest and highest quality care for many years to come. And so Advocate plans to spend $300 million to build a new state-of-the-art facility. That's my happy dance. All right. It will be carbon neutral, LEED certified, tech-enabled hospital of the future, and it will be at the former U.S. Steel Southworks site. We will be on the lakefront. This will replace the current Trinity Hospital building, which is more than 115 years old. It will be a 52-bed hospital, which includes 36 med-surg beds, 4 ICU beds, 8 dedicated observation beds, a 4-bed dialysis unit, and an emergency room with 16 bays. We have an agreement to purchase 23 acres of land to allow room to grow. We are building the hospital with the future in mind. We are expanding care and services and beds based on community need. That's also a moment to clap. So the statistics are clear. Hospital beds are highly underutilized on the South Side. Only 50% of hospital beds on the South Side are being used, according to the Illinois Department of Public Health. That is why we're investing hundreds of millions of dollars in outpatient care, community health, and wellness services. Southside residents will be spending a lot less time in the hospital and a lot more time living their healthiest lives. And last but not least, we plan to make a $25 million investment in workforce development. We know that disrupting the root causes of health inequities on the South Side will take more than patient care. A career plays a crucial role in health and well-being through income, access to health care coverage, social relationships, and various services. So in addition to the new model of care and access points, the South Side needs a thoughtful, transformative, and sustainable approach to career development, skills training, and retention to meet our community needs now and in the future. So as part of our commitment to the South Side, we are embarking on a hiring campaign. Our new model of care is an ambitious undertaking, and we will need a diverse and collaborative team in place to achieve our goal of widespread wellness on the South Side. So along with planning to keep every one of our amazing teammates, we will be hiring more than 1,000 new teammates. So we'll be hiring more than 1,000 new teammates over the next 3 years in a variety of roles and levels of expertise throughout South Chicagoland service area to care for our community now and to support this work. Yes, you heard me correctly, 1,000. So we'll be hosting job forums and deploying a new state-of-the-art recruitment on wheels van that allows us to meet with students and potential teammates one-on-one to assess skills, interests, and talents and connect them with employment opportunities. We invite you to check out our Recruitment on Wheels van, which is actually outside in the parking lot at the conclusion of the event. So I know I shared a lot of information, but we are working to solve a complex issue, and that requires a comprehensive plan. We are so excited about this unprecedented $1 billion investment. I love saying that, $1 billion investment. And we are very optimistic about what we will do together with the community to improve health and wellness on the South Side. Now, I would like to introduce the Mayor of Chicago, Brandon Johnson. He will say a few words about our investment. Mayor Johnson. Thank you.
Thank you so much. Thank you to our president and advocate for Michelle Blakely for doubling down on your efforts and love for the city of Chicago, but particularly on the South Side. This is really an exciting day for the people of Chicago. Really honored to be with you all on this monumental announcement. You know, I was just looking around the room and seeing all these amazing elected officials that are here as Michelle was talking about how careers should make sure that we are staying healthy. I just hope that the elected officials take heed to that. Sometimes in our jobs, it's not always the easiest position, but I am truly grateful to be partners with all of you in the room today. You know, today's announcement that Advocate Healthcare will invest $1 billion into health is a critical moment for our city's history to expand primary care, specialty care, and wellness services right here on the South Side of Chicago that will have incredible impact on residents for generations to come, changing the landscape and the outcomes for generations to come. Because for far too long, we have faced these disparities in healthcare on the South Side, which has resulted in a higher risk of preventable diseases and a lack of access to adequate health education and the staggering 30-year life expectancy gap between residents living on the South Side and on the North Side. It's so good to know that we are addressing that and we're doing it in a very bold way. And so from the very start of my administration, many of you all know that I've been committed to ensuring that all residents, no matter their zip code, have access to quality, affordable, and accessible health care. And with this exciting investment by Advocate Healthcare, we are making great strides by creating more access to quality health care right here on the South Side by expanding outpatient care with the new state-of-the-art community hospital as part of the growth of the Amani Village Outpatient Clinic. You know, this new facility will better serve the community. It will provide more comprehensive support, providing financial assistance programs, free prescription programs, and access to food that heals through the expansion of the Advocates Food F Pharmacy program. In addition to this investment, it will prioritize workforce development. That's really exciting, 1,000 jobs. I talked to Michelle, West Siders, you can apply for these jobs on the South Side. Now don't y'all start acting funny now once these jobs. But we know to build a better, stronger, safer Chicago, the ability to find your purpose, particularly in healthcare, certainly contributes to that. So I'm very proud to join you all today. This investment is yet another example of how innovative healthcare can be. This motto on the South Side for the residents of the South Side of Chicago will put more people in a position to live healthier lives so that they can enjoy longevity for generations to come. So thank you for this incredible work. And with that, it is my honor to bring to the stage, to the podium, the Alderman of the 7th Ward, Greg Mitchell.
I just have to say before he comes out, we have had tremendous support from all of the elected officials, and I'm so proud of the partnerships that we've had. This man has been phenomenal. And so I wanted to acknowledge him. As he comes to the stage. We are in the 7th Ward, it's where our current hospital is, and we said we wanted to be in the 7th Ward. He made it happen. Come on up, Arthur.
Good morning, everyone. Well, first of all, let me do a little housekeeping. I have to acknowledge some people in the room, my colleagues. Where's my partner over in the 7 and 10, Peter Chico, Alderman Peter Chico, 10th Ward. One of the new bright stars, Ronnie Mosley over in 21st. My big brother, former Alderman of the 6th Ward, Rod Sawyer. We got our clerk here, Anna Valencia. I have my Cook County Commissioner. He has my entire ward, so I need more money. Stanley Moore. I have State Senator Robert Peters. I'm an Omega, but I still like this Alpha, LG Sims. And I have my concierge, my fraternity brother, my 25th Ward State Rep, 25th District State Rep, Curtis Tarver. And I saved Alderman Michelle Harris for last. That woman, I'm stressing on you, aren't I? No, she has helped me become the alderman I am today. I think sometimes she wished I wouldn't do certain things because I make her a little nervous, but I represent my community.
I'm proud of you, man.
Thank you. I love you. I also want to acknowledge some people who have been here on my journey. I think this is going to surprise her. I have Melinda Kelly from Chatham Business Association. She has been my side from day one. I have who I am ecstatic to have at this time for this particular situation, the Commissioner of Department of Planning, Commissioner Boatwright. She's been dealing with me for 10 years as well. Can you marry her? And who's sick of me too? Lori Lipson. So, I did some homework. So guys, I have dreams that are kind of vivid. So the other day, my dream when I woke up was Alderman Greg Mitchell has scored another win for the southeast side of Chicago. You know, as Advocate Hospital joins IBM and PsiQuantum as they are investing in building a new state-of-the-art hospital on the former USX site. You know how huge that is, guys? That is huge. As the self-proclaimed son of the 7th Ward, I am standing before you with a source of pride. I'm nervous because, and like I told Alderman Peter Chico, we can't mess this up. We have our constituents that have known us since we were kids, and they rely on us, and we are their sons, and we cannot mess this up. Again, good morning, everybody, and thank you for joining us at this historic announcement. 5 years ago, when I learned that Advocate was looking for a location to build a new hospital on the south side, I gently laid the U.S. Steel site on the table. It didn't take traction at the time. I might add that Bernard Osbury kind of reminded me there was more than 5 years when he and I talked. When I first got elected, I told him, I want to build a new hospital at the USX site, and that was in 2015. Abraham Lincoln said, you want to predict the future, create it. So that's what we're doing here. I told the U.S. Steel site, I threw the U.S. Steel site on the table, and ever since then I've been working with Advocate to bring this site because I believe in the potential of our neighborhoods. I see what this can become, and I know what our community deserves: investment, opportunity, and growth. After years of persistent advocacy and collaboration, I am proud that Advocate Health has made the decision to invest $300 million to build a state-of-the-art hospital in the 7th Ward on the former U.S. Steel site. I'm only going to focus on the M, not the B. The 300 million means a lot more to me than the 1 billion at this time. I want to thank, for this opportunity, I want to thank the leadership of Peter Chico. I want to thank the leadership of Governor Pritzker. I want to thank the leadership of Mayor Brandon Johnson, because without some things that happened before now, I don't know if we would be in this position. So I'm going to be grateful throughout this entire process. And I'm going to make sure I acknowledge those who I feel that have contributed. For over 30 years, the former U.S. Steel site has been a painful reminder of disinvestment and missed opportunities that have impacted our neighborhoods. It has contributed to significant challenges my residents know all too well: declining home ownership, abandoned properties, the erosion of local businesses, and limited access to essential goods and services. But today, we are turning this page. Today marks a transformative moment for the 7th Ward and the southeast side of Chicago. This new hospital represents more than just a building. It's a significant investment and a symbol of progress in the 7th Ward, and a powerful catalyst for revitalization, laying the foundation for stabilization and further investments throughout the 7th Ward. As you heard earlier, 23 acres, the hospital will be located within 23 acres between 79th Street and 83rd Street, west of Lakeshore Drive. With this new hospital, Advocate is committed to hiring over 1,000 new employees over 3 years, offering job training and hosting workforce recruitment events to ensure that these opportunities are available to the residents of the 7th and the 10th Wards. I want to thank Advocate Health for finally coming to their senses. Damn, guys, remember Glenn Ross? Always be closing. They just did not get it. But I also want to thank the residents of the 7th Ward for their resilience and commitment and your belief that better days are ahead with me as your leader. Again, the best way to predict the future is to create it. And today we are creating a brighter, healthier, and more equitable future for the southeast side. Thank you.
Good morning, everyone. The sun is shining into this beautiful room. My name is Grace Ho, and I'm the Deputy Governor for Health and Human Services, and it's an honor for me to be here on behalf of our governor, and I'm excited to be here with all of you because today is about hope. It's about sunshine, apparently, healing, as well as opportunity. I want to recognize my colleague, the Director of Healthcare and Family Services, Lizzie Whitehorn, who is here, who does so much of the important work for the state of Illinois in making healthy communities. I want to thank the Advocate Atrium team for their vision and tenacity in bringing this work to light, and for listening to communities and for forging a path towards a healthy South Side. We appreciate your partnership and future status as neighbors on the Quantum site, on the former U.S. Steel site. It has been a labor of love for the governor to see that developed. And it's exciting to see further activation on this land and to see how this activation will translate into health and job opportunities. We all know that the data shows that health outcomes is much more than medical care. It's much more than hospitals. And although we love doctors and nurses, it's much more than about you. The biggest impact on health outcomes is the community you live in, the life factors, your race, your ethnicity, where you work, your income, your wealth, and on and on. And this investment recognizes that health is a hospital plus neighborhood clinics, plus medication, plus jobs, plus community access, plus social workers, and on and on. And I'm excited to be a part of this collective energy and work from Advocate and the other leaders here. And I want to say to all of us that it's going to take more than Advocate to achieve what Michelle has set out, which is widespread wellness. And it's going to take all of us to close that life expectancy gap that is too real here in Chicago. And so let us all together spend our energy ensuring that people are out there living their lives vibrantly in community and are spending way less time in hospital beds. Thank you so much for having me. With that, I'm very pleased to introduce our partner in crime prevention, Senate Leader L.G. Sims.
Good morning. This is a great day for us to be here. You know, and it's, to me, it is telling, you know, Pastor Moss, it's for us to be in Imani Village when Imani means faith in Swahili. And we are talking about, you know, the word tells me that faith without works is dead. And, you know, Advocate is showing us that they are going to do good work. They are showing us that they're not just talking about it, they're doing the work. Folks can stand by and say what they're going to do or what their plans are, but when you really put your plans in action, that's when work starts to happen. You know, you think about $1 billion in overall investment, but $300 million to address health outcomes right here in this community. Reimagining what healthcare really looks like. Making sure that folks don't have to wait months to get an appointment. 85,000 new appointments. Think about that. Think about how that changes health outcomes. Because if someone knows that they can get into a doctor's office, they're more likely to go. If they believe that they have to wait months before they could be seen, they're more likely to withdraw or move away from care. But that's not the case anymore. You know, one of the first things when Michelle and I talked about this project, one of the first things I mentioned was the change in the ability or the number of beds that will be active in this community. One of the reasons that I stand here today so immensely proud of the work that Advocate is doing is because when I asked the question, not only did they have an answer, but they had a plan that they could show me. They could show me that plan that says, here is how we are going to change health outcomes on the south and southeast sides of the city of Chicago. So we are going to make sure that we have healthy outcomes. And this is coming from someone who is not just, I'm not just the person who represents the area where advocate community members live. I'm an advocate patient. I'm a customer advocate. And I stand here right now having had 2 knee surgeries at Advocate Trinity. And my primary care physician is here, so if I fall, I know I'm in good stead. But that having the ability to make sure that we can get healthy, quality health care right here in our community, not that we out-migrate to somewhere else, means so much to the health of this community. So thank you, Advocate, for standing up, standing with us, and making sure that we have healthy outcomes right here in our community. God bless. And next, thank you. I will bring to the podium my partner in progress, Senator Robert Peters.
Good morning. I'm State Senator Robert Peters of 13th District, and this is a beautiful day for the south side of Chicago. Actually, it's a beautiful day for the city of Chicago. I just want to thank Advocate for putting this investment in. We oftentimes talk about the disparities, the 30-year life expectancy gap, when we look at birth equity gaps, when we look at the disparities in this city and in this country. We talk about it a lot, but we forget that we are the richest country in the history of the world. These gaps should not exist. These gaps are an embarrassment to me and to so many people. And $1 billion is vitally important to close these gaps. We talk about public safety in the city of Chicago all the time. It's on every news station, it's in every headline, in the paper. Sometimes it's talked about here, New York, DC, Los Angeles, wherever. But it's clear what gives us public safety. You give people a good job, you give people good health care, you make it so they can get from point A to point B relatively easily. You give people opportunity and hope, you're going to get safety. What we are doing here today and what Advocate's doing here today is about safety for everybody. 30 years since the steel mills left our town and our community, people have been hurting. They've been hurting across the board. And today, we start to heal that harm. So I'm honored to be here. I'm honored to do this work. I'm grateful for Advocate. I'm grateful for every leader here. We have a lot of work ahead of us. I try to tell people it's $1 billion. This is just the beginning, not the end point. And thank you so much. Thank you, everybody. Yep. Next up, I'll bring up a real fighter and a true champion, particularly for this site and for folks on the south side, Representative Curtis Tarver.
I've been saying good morning so long, I'm about to be saying good afternoon. So thank you all for being here today. This is genuinely a very exciting milestone. Today we're not just celebrating the announcement of a building. We're celebrating the promise of improved health, better access to health care, and a healthier future for the community. Suffice it to say, this investment literally will save lives. It also helps with preventative care that can lead to more full lives and ideally eliminate the unfathomable 30-year gap in life expectancy between the south side of Chicago and other areas of the city. This $1 billion investment by Advocate is a statement, and I don't mean this in the political sense, but in the literal sense, it demonstrates that our lives matter. They matter. This is not just about the physical infrastructure. It's about the doctors, like Dr. Everett, who's been on me since day one. And thank you for all that you do. It's about the nurses, but it's also about the CNAs. It's about the staff, the other healthcare professionals who make this place a center of compassion, innovation, and care. It's about the support and partnerships from the community, from local businesses to our dedicated first responders, all working together to create a better future for our residents. Often in moments like this, we look around, we think a handful of people, and we move swiftly to the next task because there's so many things that need to be done, so many things to tackle. But in this moment, I think we all owe a huge debt of gratitude to the community. I would like to personally thank the community for entrusting me to represent you, and for all of us to represent you. Thank you for entrusting Advocate with your health, with your lives. Thank you for your patience, but most importantly to the community, thank you for your persistence. And since I didn't take my full 2 minutes, I'm going to take a very quick detour and just thank Crystal Olson. I had a phone call with Crystal yesterday evening, and afterwards my daughter said, "Dad, you have so many things on your plate. Why are you going tomorrow?" I said, "Sweetheart, beyond the fact that it's just a huge investment, I gave Crystal a very difficult time because we wanted something, and she said, we're going to deliver. And so if I can harass you privately, I can thank you publicly." Thank you very much, Crystal, for all you've done. And next we'll have County Commissioner Stanley Moore.
Good afternoon. I'm going to have to say we need to give State Rep Tarver another round of applause for that one. He said exactly what the rest of us were thinking. We harassed them privately and thanked them publicly. I'm Cook County Commissioner Stanley Moore, and it's an honor for us to be here today to celebrate this investment in health and well-being on the south side of Chicago. I want to thank all of these elected officials that we have worked with, especially Michelle Harris, Alderman Peter Chico, Greg Mitchell, my alderman, and he didn't tell you that he actually lives like right across the street from Trinity Hospital. And LG Sims, who mentioned that he is not just a representative, but he's also a patient. Well, I too have been a patient of Trinity. It's our hospital of choice. It's a hospital that we hold near and dear to my heart. My daughter, who recently was playing in a basketball game in Las Vegas, who tore her Achilles tendon, we flew her home. And guess where we flew her to? To Trinity Advocate. I want to thank Dr. Greg Primus, who performed the surgery. I want to thank Dr. Marlon Everett, who has been our cardiologist and also an advocate in the community for always staying on top of our community. Thank you. I want to thank Dean Nichols and his team, an amazing team. Give them a round of applause. They came to our community with a commitment. They said what they were going to do, and they did it. And that deserves an applause. The new Advocate Trinity Hospital will be a beacon of hope and health, providing state-of-the-art medical services, expanding access to vital care, creating jobs through this whole process. But more importantly, the investment represents an understanding of the unique healthcare needs of our community. As your commissioner, I'm committed to working alongside Advocate Healthcare, these local leaders and residents to ensure the development needs and the needs of our community are positive and long-lasting. This hospital will not just be a place for treatment, but it will be a cornerstone for health, education, economic opportunities for generations to come. And as Dean Nichols said, I don't think I need to move to a different zip code to live a few more years. Thank you, Advocate Trinity. I'm Stanley Moore. Now I'd like to bring up our leader, Michelle Harris, A4.
Good morning. Now, I'm so excited you would think this is my project because I'm going to live vicariously through the 7th Ward Alderman, who is my partner in crime, and we sit together and we are good friends. We talk just about every day about something in the universe. But I really wanted to start by thanking Dr. Michelle, who came to my office and talked to me. And Crystal came, of course, too. But it means a lot to me. I get deeply invested when people say, don't come. You come to me, because I'm always willing to come. But when they come to me, I am truly grateful because it says something about their character and who they are and what they're willing to do to change the universe they exist in. So today, I'm going to go a little off script, because I too am a Trinity-Knight. And so I want to start by telling a story that during COVID, as I had breast cancer, I'm coming out of breast cancer, and we go back to work, the entire office got COVID. Everybody but Michelle Harris, who knew, got COVID. So we met Dr. Marlon Everett because one of my employees who I called was going to die. And I said, get up, go to the hospital. And when I talk about Trinity and embedding this, it's only there because the people that work there make the difference in people's lives. The people that work there care about their patients. They want their patients to be better and do better. So I can't stand up here and not acknowledge you, Dr. Everett, for saving the life of my staff person who had pneumonia and transforming his life and still trying to make him a better person. We're going to send him to Jesus, but we're going to try to make him a better person. But the second story is about the other staff person who had pneumonia and was in the hospital also. Through that, she found out that she had cancer. And it became another extended journey with doctors working for her, caring for her at Trinity Hospital. And so these are the things that transform communities, and when you're exposed to wonderful physicians and nurses and staff at Trinity Hospital who become the face of what the message is. So I cannot thank you all enough. And Dr. Taylor, who is my husband's doctor, we got to pray for him too, because he's hard-headed. He don't do nothing Dr. Taylor tell him to do. But she's a good doctor, but we just got to make the patients listen. And I say all that because as we talk about what Trinity Hospital is, it's the people that work there that make the difference, that send the message. So today, I am so proud to be here today because I know what this project is going to do for the 7th Ward, for the 8th Ward, for the 10th Ward. And I'm grateful. It could have been anywhere on the South Side, but I'm telling you, I'm so happy for Alderman Greg Mitchell to be the leader of this project. He has worked so hard for the last, how many years we've been together? 10 years. Ooh, time is flying. The last 10 years he and I have been together. I've been there 18, but he's been there 10. And so I am so proud of him. I'm going to do whatever I need to do. I'm going to, we ain't got to set the mayor on fire because he all in. So we're going to work with the mayor and the governor and the state to make sure that this project, and Alderman Peter Chico, who is our other partner in this, and so we couldn't do it without you, Peter. So thank you for being a real, true partner in this and being there. I won't go over everybody else, but really, I am blessed to be here today, to be a part of this. And Dr. Michelle, I love you.
Good morning. My name is Sona Jones. I'm the Chief Health and Wellbeing Officer for the YMCA of Metro Chicago. I'm so thrilled to be here and in awe of all of you and who's behind me. You know, at the Y, as we approach January, we're thinking about, gosh, we need some wellness influencers to talk about our membership. This room are the wellness influencers that we're looking for. I'm just in awe of all of you. The Southside YMCA is delighted to be the first of Advocate's new neighborhood care locations. This important partnership is a natural extension of our commitment to health and well-being and health equity in neighborhoods throughout Chicagoland and the wonderful relationship that our two organizations already have. The YMCA has been a cornerstone in Chicago for over 150 years, with this location serving the community for more than 40 years. The Southside Y serves more than 4,000 residents annually and continues to deliver on our commitment to community development through services and programs that cater to the diverse needs of those we serve. This location, the Southside Y, is a community hub already. It's a familiar and trusted place where we see people of all ages all day long, and it's going to help people feel more comfortable when they're asking questions and seeking help that they need to better prevent and manage chronic conditions that plague our Black and brown neighbors. We plan to open early next year, which just blows my mind that this team is able to work this quickly. And we imagine that our first patients will be those who already come to the Y seeking fitness and fellowship. But we believe that the word is going to spread quickly, and community members will soon view the Y as a convenient access point for healthcare in the neighborhood. This partnership helps to actualize the Y's vision of becoming a health and well-being platform that bridges the gap between the medical care we get in clinical settings and the preventative care that we all need to achieve greater health. And because we're the Y and we believe in the power of play, we're going to make it fun for people. We're so grateful to have a partner like Advocate who cares as deeply about the Southside YMCA as we do. Working together, I see wonderful things happening here that will so greatly benefit the community. Thank you for having us. And I get to introduce Dr. Julie Taylor.
Good morning, everyone. My name is Dr. Julie Taylor, and I'm an Advocate primary care doctor. And I am so excited. You all just don't know, this has been a long time coming. As someone who was born and raised on the south side of Chicago, less than a mile away from here, I'm incredibly optimistic about the benefits this investment will have on our ability to prevent the onset of heart disease, stroke, diabetes, and other chronic illnesses my physician colleagues out here and I treat every day. The prevalence of chronic disease in the zip code that we're in today and over the south side, all across the south side of Chicago is alarmingly high. And it doesn't have to be that way. It shouldn't be that way, because most people can avoid the conditions behind the South Side's lower life expectancy rate. With greater access to doctor's appointments, patient education, and support in making healthier life choices, I am confident that together we can significantly lower the percentage of people in this community who get diabetes, heart disease, stroke, kidney disease, and help them avoid the complications that these conditions bring. Advocate assembled a team of epidemiologists, statisticians, and health service researchers to review 2 years of data for a group of 24,000 patients who receive health care on the south side of Chicago. And they examined the connection between primary care, clinical utilization, and diagnosis and treatment of chronic disease. And here's what they found. Patients without chronic diseases who had a primary care visit with their provider were over 40% less likely to receive a new diagnosis of hypertension or type 2 diabetes the following year. And people with diabetes who had a primary care visit with their physician, over 30% were less likely to develop uncontrolled diabetes the following year. We also know this works given the improved outcomes we've seen in the enhanced primary care offerings coupled with chronic disease management on the south side. The proactive, coordinated care produced a reduction in not only hospital admissions and emergency department visits. So that's a win. This demonstrates the positive impact preventive care can have on leading a healthier life. So what does this all mean? It means that Advocates Health's new model can dramatically reduce the overall burden of chronic disease in our community. It means fewer hospital stays and more quality days with loved ones. It means everything to our community, and I'm really excited about this. Now I want to invite up someone very special to me, Mrs. Porter, who lives right here in this community.
Good afternoon. Wow, I can still feel the energy in this room. I'm excited. Like it was said, I'm Betty Porter, and I'm a cheerleader for this community. I cheer about the good things that go on, like what's happening here today. To start, I really appreciate how Advocate came to our community and asked our opinions and then went back and developed plans based on our input. Now that's a partnership. And I'm quite confident that together, we are going to improve the health on the south side of Chicago. I have been a resident here, living right down the street from Advocate Trinity Hospital. For almost 60 years, my husband and I raised our 3 children in this community, and they're grown. Our daughter, who incidentally was born at then South Chicago Hospital, she and her husband live right across the street from me, and we're neighbors. So we get the pleasure of watching 2 of our grandchildren grow up here. And those 2 grands were also born in Advocate Trinity Hospital. So you see, the Porters have a little history with that hospital down the street. I believe in this community, and I know God has a plan for us. Together with Advocate, we can make a difference and improve the lives of all who call this community home. Health is deeply personal to me. I was recently diagnosed with a chronic heart condition. Go figure. However, I am very optimistic about the plans Advocate has outlined for the future, our future, Betty's future. These visions that they are trying to keep people out of the hospital is important to me, because that's exactly where I want to stay, out of the hospital. Look, I'll come visit you, but I ain't got to be admitted. I am proud to call this community home, and even more prouder still of what the future holds. Together, I know we are going to do great things. If you notice that word together, you've heard a lot. That's because what is happening here today is a result of this community and its stakeholders coming together, strong and committed to make a positive change. Be it Advocate Trinity Hospital, Compassion Baptist Church, or Imani Village, all together it's going to work. Sometimes we were so in sync with each other that we almost completely completed each other's sentences. Come on, you know, you've seen other groups and organizations, and it doesn't happen that way. They have conflict. Sometimes people have different opinions and different agendas, but not us. We had one agenda, and we were committed to it. And I am so happy that you allowed me and others like me to not just come to the table, but be in with the conversation. You listened to us. You walked with us down the street where we live, so you saw our concerns. That's just beautiful. So, in closing, I want to say to you, thank you for showing up. And y'all, thank you for showing out. And all of you, thank you for showing how it's done. And guess what? I love a show off. God bless.
Thank you so much, Miss Betty. Miss Betty texts me. She lets me know what's going on in the community. She is truly, truly an advocate for us. And so I thank you very much, Miss Betty, for being here and being part of it. I thank the entire panel. I thank all of you for being here and being part of this moment with us. If you can't tell we're giddy, we are giddy. And I'm sorry that my phone is ringing. All right. And so we get a chance to, at this point, just really thank everybody for being a part of the process, being part of every step. Ms. Betty talked about the Community Engagement Center sessions that we held. I had the privilege of being out and listening to our community. We had over 400 community members come out and talk to us about a plan and what healthcare could look like for them. And I am so proud that what you heard today is us delivering on what we heard. This was a co-creation, and we're very proud of that. We're so excited that we're building a model together. We're investing in the South Side in a way that means that we will literally change lives. We're very glad to have every one of you with us on this important journey. This is a wrap-up. So there will be refreshments in the back of the room. Please enjoy them. We have time for a few questions. Before we do the questions, I think we're going to take a quick picture, and then we will be ready for questions.